Website treatmentwiki.com presents mesothelioma. There are various mesothelioma complications. Consider the example of mesothelioma complications. If pleural mesothelioma grows in the chest, it can compress vital structures in this area. This causes these mesothelioma complications: shortness of breath, problems with swallowing, pain or discomfort in the chest, swelling of the face and neck caused by compression of the veins, severe pain due to compression of the spinal cord, pleural effusion, fluid in the pleural cavity. Morphological diagnosis of mesothelioma is difficult due to the variety of morphological variants of the tumor. Here is an example of mesothelioma complications. Provide surveillance of malignant pericardial mesothelioma. Diagnosed at autopsy. Patient 64 years old. Moved from Kazakhstan to Belarus and sought medical attention complaining of pain in the chest. Right arm. A weight loss of 17 kilograms in 6 months. Alopecia and increased blood pressure. He considers himself a patient for 6 months, but the medical care is not addressed and did not pass any examination for 7 years. After the examination, the patient was hospitalized in satisfactory condition and the diagnosis: cancer of the right lung, chronic lymphocytic leukemia, lymphoma, chronic pyelonephritis, secondary arterial hypertension, chronic ischemic heart disease, diffuse cardio. On the second day of hospitalization, the patient's condition deteriorated. The woman complained of severe weakness, chills, shortness of breath. The woman was transferred to the intensive care unit where cardiac arrest occurred. Despite resuscitation, the death occurred. The final clinical diagnosis: 1. Acute deep vein thrombus phlebitis, right howling of the lower extremity. Recurrent thrombotic embolism of small branches of the pulmonary artery. 2. Chronic pyelonephritis. Secondary arterial hypertension. The possible impairment of cerebral circulation. Uremia. Erosive gastritis. Complications of mesothelioma: gastric bleeding, comorbidities, chronic ischemic heart disease, myocardial infarction ECG, atherosclerosis of the aorta, coronary arteries, chronic bronchitis, emphysema, diffuse pulmonary fibrosis, chronic pulmonary heart diabetes mellitus. First identified. The autopsy determined that the patient was ill with a malignant pericardial mesothelioma tumor invasion and metastasis to the myocardium in the regional lymph nodes. As a manifestation of paraneoplastic syndrome, the patient developed phlebimphrexus veins of the lower extremity followed by thrombotic embolism in the pulmonary artery. This was the immediate cause of death. In vivo diagnosis of pericardial mesothelioma can be based on the data of chest radiography, computer tomography, thoracoscopy with biopsy examination of the tumor. However, in the above observation of the extreme rarity of pathology and short stay patient in the hospital, determined the diagnostic error.